Chapter 18. Coronary heart disease, very important indeed, also called ischemic heart disease and coronary artery disease. And what is the main problem over here? Careful with the second bullet already. There is a true or false in one test. And regarding that particular statement, characterized by the lack of delivery of oxygen in that blood to the myocardium, caused because we have atherosclerotic coronary arteries disease over there, meaning that there is a lot of obstruction inside of those coronary arteries. The question that many of you will see, because this one probably is in 2 or 4, is that one over here, that last bullet, and is a multiple choice, meaning that this slide already have 2 different questions inside of the quizzes. Careful with that one. Even that the second one or the first one is one true or false, but the last bullet, many people, probably 50%, will see that question multiple choice. I will change something in one of those bullets over there. Let's move on immediately. The etiology of the coronary heart disease and the risk factors, I will not go with this one to do a question, meaning that you can discard this one right now. That doesn't mean that it's not important. It's because I don't have a space to ask you this one. But then the next one is important for me because make a huge contribution in this particular coronary artery disease, and is the mechanism of atherosclerosis. Now pay attention over here because this is a question that engulfs 3 slides, meaning this slide is part of that question. Because there is variance of the questions, I am in one particular test taking these two. In the other test, I am taking these two. Depending what you get, you will see. Meaning, for sure, this is a slide that with the next one will do a huge multiple choice. Okay? The other variant to this question will also include number 6. Meaning, 4, 5, and 6 will do 2 different questions of the same subject. I know it's too much, but remember that these particular slides are very important in cardiology and in medicine in general. The coronary arteriosclerosis, because it's one of the main cases that you always will see in the hospital. Meaning careful with those 3, because those 3 will do 2 different questions in the 2 different tests, meaning that everything over here will be 2 or 4, 2 or 4, and are multiple choice, both of them. The next one, the mechanism of the plaque, I decided to remove this one out. The coronary arteriosclerosis, the increase of the plaque vulnerability, I didn't have the opportunity to ask you this one. That is the reason that this one is out. But jumping to number 10, careful with this one, ischemia. That is something that I always like to ask in a multiple choice or true or false, meaning that it's a question regarding this file over there. Okay? And normally, that is basically what affects the hearts over there. Jumping to the next one, the coronary perfusion and how it can be altered. This particular one is not coming now, it's coming, yes, the previous one. Just this one over here is for the midterm. This is a question for the midterm that is very important. The next one, acute occlusion, plaque disruptions, and thrombo will result in unstable angina, meaning careful with this one. I have something in one of the tests, probably was the last test that I did, of the 4, that will include true or false over here. Meaning true or false just in one test of 4. In the next one, I decide to remove this one out because I will talk about the anginas later on. But then I will have the acute coronary syndrome. Very important indeed, there is one question regarding those 2 bullets over there, meaning one test will have this true or false. Apparently has some kind of communication somewhere. Okay, now I'm coming back. All right, true or false. and true or false, meaning both bullets are true or false over here. Okay. Now, angina pectoris, very important, because what I did over here is that I did a multiple choice. I will explain from which one, not from this one, but from this one. In this particular slide, somebody will see this multiple choice in 2 of the 4 quizzes. But other 2 tests will see this one, 2 of 4, meaning everybody will see angina, but one set of tests, 2 of tests will see the stable, and the other one, the unpredictable. Meaning careful with that because the both anginas are important. And remember, for the person that still don't know what is angina, you already have a coronary vessel that is partially obstructed. And because it's partially obstructed because atherosclerosis, check going back outside. And well, if you have a problem with audio, I suggest to log out and to log in. Yes, both, both, both always means. All right, that is a good idea because my system is still working fine from my queue and from my side. Probably something in the other side. Now, again, when you have a person with angina, what that means is that is a person that have coronary artery disease. Yes, that is correct. Coming back for the people that is lost, this one is a multiple choice, 2 of 4. And the next one, multiple choice, 2 of 4. Again, half of the classes will see one, half of the classes will see the other one. But to go to the point is that the angina is a person that already has some partial obstruction of that coronary vessel in the heart, meaning any extreme exercise that he will do, automatically the heart cannot provide, or that artery is partially obstructed and cannot provide the amounts of blood that the heart needs. And that is the reason that why that person starts to feel chest pain. Okay, let's go to the next one. This one is a multiple choice, exactly like that. There is 2 tests of 4 that will see this fellow. As you see over here, and for the people that already saw that case about the chest pain in the discussion, if you didn't basically mention this one as a part of your documentation, you are not discussing the case because you need to study the EKG first in that case to make reference about what is the situation of the patient. Some people, I have almost 20% of the student that he said that the person have atrial fibrillation. Good for you. You kill your patient right there. If you don't know how to recognize a heart attack, what we can expect of that patient prognosis? Very good. Meaning, yes, I know. Meaning, next time, if you can use the Google for basically anything in your life, I think that we can Google, let's see how an EKG look in a heart attack and compare that one with the one that you have in the discussion. That is a person doing the proper research. I want to see how an EKG look in atrial fibrillation and compare with them. Anybody did that? Of course not. So some people did a good job and basically went directly to the case and basically tell me, hey, according to the EKG, probably the guy is suffering a myocardial infarction. The only problem is they are not telling me that the main reason why I know in that EKG that the person have a myocardial infarction is because there is an ST elevation. Yeah, I will explain that tonight. Let's move on over here. Again, careful with this one, with the other one, because this particular slide, plus the previous one, sometimes I will include something extra to this one from that 19. Okay, moving on. This one in particular is out. I will not go with this one. But as you see over here, the person will suffer a lot of pains if they start to do an extreme kind of workout when that coronary vessels cannot supply the blood to the heart. Another important question that is coming is this one. This is another variant. I think that this one, somebody will see it. 1 of 4 is a multiple choice. Over here, I can change many things over there. I can change the time frame. I can change the place that happens. I can basically change which particular tissue show up first, meaning careful with those particular things that I change in a multiple choice. But it's there exactly like that. The diagnosis, again, out. As you see over here, for the people that was doing the discussions of that case, you have it over there. In this one, I will do an exception, and I probably will ask a true or false about this particular treatment. It's the only one that probably I will ask you something about treatment because it's important for me, meaning multiple choice, 2 or 4. Many people ask me, what is the enzymes that I need to know to rule out if that person have a chest pain for something different from a heart attack? There you go, the beautiful enzymes that I need to send a stat to the lab to make sure if that person is suffering or not a heart attack. If these particular fellows are increasing, then for sure that 100% of the cases, the guy have a myocardial infarction no matter what, okay? But again, I will not ask you this, but this is something that you will see in the core no matter what. The acute coronary syndrome, myocardial infarction lead to drop in the cardiac output. Obviously, the system, especially the sympathetic nervous system, will try to compensate for the lack of power of the heart. And the only thing that they can do is to increase the amounts of fluid in your vessel, because more fluid in your vessel increase the pressure inside of your system. That is basically what your body do when your heart is weak to maintain their own blood pressure. Basically, you start to inflame yourself inside. But I will not ask you this one. I will not ask you this one either. But as you see over here that the prognosis in acute myocardial infarction is very difficult sometimes because all will depend how quickly you resolve that particular obstruction inside of that vessel. It's very important to notice that some particular hospital, they have the golden, I would say, 90 minutes in some cases, or the golden hours, 60 minutes in others. Meaning, if you can reach in an hour or less to that particular ER, we can save that part of the cardiac muscle that is suffering the problem. Because we have, believe it or not, powerful medication that can break down that thrombus like a TPA and another ones, and the muscle will never see any kind of damage. The problem is we can make it below 1 hour. That is the question. If not, that medication will not make any kind of difference because already the heart will suffer a particular dead tissue in that muscle. Okay, that is some hospital called that the golden hour. If you can reach to that particular moment, you probably will save that heart, and that heart probably will never, never, never will feel any kind of problem. Moving on to the next one. Again, out of the way. You already have a question. I don't know over there. And then you have the sudden cardiac arrest. Yes, you have a question with this one. And this one is very important because we have a lot of patients, especially teenagers, that they don't know that have any particular problem in the heart, congenital of the other origin, and they die suddenly. And it's because sometimes they don't have the opportunity to do any screening before. This happening very often in any middle school and high school. That is the reason that now so many public schools like to do a screening for free to make sure that the heart in development is fine and they don't have any kind of secret that later on they discovered in a particular game. Because it has been so often that the basically the child or the teenager died in the middle of that game. Meaning this is a multiple choice, 2 or 4. This one is another multiple choice, 1 or 4, multiple choice. You have it over there. It's the same thing. I will change something. I have plenty over there from where I can change over there. The endocardial and valvular structure may be damaged for all of that. I didn't ask you this one. This is something that you will see in cardiology and probably in the core. You will enter with more details, but you need to know that. And then we have some particular check and go in and out. My audio is still working. Probably this is another place in another place of the galaxy. Then we have some endocardial and valvular diseases. No, I will not go with this one because this is like an introduction. But you have the first question over here. Careful with this one. This is a multiple choice, 2 or 4. Exactly like that. Some people will see the mitral regurgitation, but this one is just 1 of 4. This is from the new test. This one, mitral valve prolapse, I decided to remove it away. But the aortic stenosis, 2 or 4, you will see it. It's exactly like that. Multiple choice. One test, the last one, is showing this multiple choice. Remember that stenosis means that that opening became smaller, and that is a problem for the heart to pump that blood out in a smaller aperture of that valve. That can increase basically the power that the heart needs to do, that at the end the heart will suffer a lot of deformities, and one of them probably will be hypertrophy. Okay, then the famous dilation, and after that you start to have heart failure. Okay, again 1 of 4 in this one. This one I decided to put it over there, is in 2 of 4, multiple choice is there. Remember who is the streptococcus that they can do that. The rheumatic disease is very interesting situation because also include how the immune system react. For the people that don't know this, I will say something very quickly about this disease. It's very simple. Your body create antibodies against these particular fellows, the streptococcus, those proteins that the streptococcus have in the surface. The problem is that for bad luck, our heart have similar antigens in the surface too. Meaning when antibodies reach inside of the heart, they become confused and start to attack those particular cardiocytes inside of the heart and basically creating a damage in those particular valves of the heart. That's basically what happens. Your immune system attacking by mistake your own heart, thinking that is the bacteria. Okay? And that is forever because once that the damage is present, you will never go back from this one. Again, 2 of 4. Careful with this one. Endocarditis, I decide to remove it away. Still, careful with those bacteria. Careful with the bacteria, even that I didn't ask you, but this is something that always will be hunting you out later on. Which particular agent create this particular problem? But I don't have a question from this one. The myocarditis, yes, I have a particular question, but it's not from this one. I will tell you that is the next one. This is a multiple choice, 1 of 4. Okay? 1 of 4. The next one, no. The next one, no. But this one, yes. This is multiple choice, 2 of 4. As you see over here, What I am trying to tell you with this pathology is that when the heart is under stress for too long, it starts to compensate because that workout increasing his muscle mass. And that's what we call hypertrophy. The problem with the hypertrophy is that the heart always will stay like that forever, meaning that you will stay in high blood pressure forever. And that will be basically the beginning of a series of problems over there. That is correct. Meaning, careful with this one, 2 or 4. There is one question regarding this one in the new test, 1 of 4, multiple choice. From there, you have pericardial diseases. I will not go with this one right now. The fusions, I will not go with this one right now. The cardiac tamponade, this is something that you will see in the midterm. If you remember that beautiful movie of Marvel, Doctor Strange, the first one, obviously, what happened to him inside of the hospital that his friend need to put a huge syringe in his chest is exactly that, cardiac tamponade. You have a huge amounts of blood that start to come out around the heart, around that pericardial sac, and the huge amounts of blood is so much that don't let the heart to pump the blood, don't have a space to contract and relax, and that is what create the cardiac tamponades over there. Meaning that we don't put that blood out from there, that person will die. Exactly what happens in the movie. But again, I will not ask you this one now. This is midterm. The pericarditis, no now. The acute pericarditis, this is something that we will see in the midterm, no now. The same thing happens with the chronic, midterm. I will not go with abnormalities and this particular moment, just with one, I will tell you which one, meaning that I will jump this one. 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 Now you see, I jumping a lot. I will jump this one, but careful with this one. This is a multiple choice. 1 of 4. The quotations of the aorta is another multiple choice, and this one is 2 of 4. Multiple choice, I can change anything over there. It's a copy paste. That's why it's easy for me to do a question exactly from the PowerPoint. The pulmonary stenosis atresia, no. I will not go with this one because there is a disease that I would ask you that include these particular pathologies, meaning not this one, not this one, but I want this one. The tetralogy of Fallot is an interesting feature because it's 4 deformities that the heart presents. A ventricular defect, meaning that the ventricles over there in the septum, basically the area that divide the ventricle, have a hole that communicate between each chamber. The aorta is in the wrong position, basically in the middle over there of both opening. Pulmonary stenosis, meaning that those vessels that goes in the directions of the lungs over there and back are very tiny, and it's difficult for that blood to basically go back and forward. And right ventricular hypertrophy. These 4 defects in the same heart is what we call the tetralogy of Fallot. Normally, when you have a patient like this, you already know that has some kind of genetical problems because they are very associated with these particular problems, okay? But I have a multiple choice because this is a case that normally you can see 2 or 3 during a month or probably every 6 months, meaning that, believe it or not, is a little bit prevalent, okay? From there, you have the question number 3 that I will not go with that one. the transpositions of the great arteries, I decided to remove this one. Yes, that is correct. Was a multiple choice. Then we have the truncus arteriosus. Yes, careful with this one. 204, multiple choice. And believe it or not, my dears, this is the last one from this particular chapter, and is also a beautiful multiple choice in the new test. 104. Okay, I will stop the recording to deal with chapter 18 out.